Welcome to Daily Coverage from I2OD. My name is Dr. Mike Cooper, and I'm here today with Dr. Jack Schaeffer, and we're going to be talking about ocular surface and ocular wellness. Where do we go from here? Jack, tell me about your course.
Well, first of all, it brings a whole new aspect to eye care. We're talking about wellness, which is primary care, okay? It means, what do we do for patients now to make sure that they don't develop disease? You know, we look at all our lectures today, and 90% of our lectures are all about reactive medicine. It's about treating signs and symptoms. Wellness means, let's treat that patient before they have the signs and symptoms. If we can predict that someone's going to have a dry eye, if we can predict someone's going to have glaucoma, let's get all the data we can at an earlier time in life, and let's start looking at lifestyle changes, medicines. What can we do, vitamins by the way, what can we do to make sure that patient doesn't develop the disease, and therefore we don't get into the circle of treatment, signs, symptoms, and it's so much harder to treat.
Yeah, I completely agree with you. You know, that preventive model is really where everything is going in medicine, just in general. How do you engage and really elevate in your practice? How do you make that happen?
Well, first of all, you got to educate your staff. Actually, first you have to educate yourself. We have to believe it. Now, you know, Jim Murphy, who started this whole thing about 3 years ago, brought a bunch of doctors together, and we sat in a room. We said, can we move into this preventive model? And it was a phenomenal experience because we really started talking among ourselves. How do we move optometry into the future? And because that's what we're looking at, future, what it is. So first we had to educate ourselves. We have to believe that we can make a difference. Myopia prevention. I mean, should children not be treated earlier so we are retarding that myopia versus putting them in thick glasses, contacts, or LASIK surgery later, which is one of the perfect examples of wellness. So first is believing it, all parts of it. And like I said, whether it be dry eye, whether it be just vision, myopia prevention, glaucoma, let's believe that we can make a difference early. And then we got to train our staff, because the staff, we all know, our staff runs the show. That's what happens. They have more communication with the patients than we ever will. And so we want them to understand this is not the old optometry. This is the new type of eye care. And then lastly, and this is going to be the difficult part, is how do we educate the public? You know, how do we tell somebody that they have vision insurance and it says you can be seen every year, but the child needs to be seen twice a year? We have to change the glasses twice a year so we have the right prescription in the glasses or contacts, but the insurance only covers it once a year. How do we get that message to our patient that they need to be part of this process? So again, educate ourselves, number one, educate our staff, number two, and then bring it home to the patient. And that's going to be the long challenge. But once we get to that level, industry can help us because we can start doing national commercials. You know, in these meetings we've been having, there's almost 15 companies that are sponsoring us to sit in a room together to discuss this issue, how we have steps 1, 2, and 3.
Do you feel, and I'm going to use the dental model as a analogy here, that eye care can emulate that and actually make it something we can use? For instance, they've educated patients to come in for every 6 months. Do you think it's possible in eye care to do the same thing?
Absolutely. In fact, at the first meeting, we had the dean of the dental school lecture to us about how they have moved that dental model into a preventive care, because dentistry's done it the best. We also heard from one of the professors from the School of Dermatology, because dermatology is moving in that direction, you know, doing full body scans of skin, pre-cancerous scan. So yes, I think that is the model that has to happen. And especially with the new ACOs and the new medical care, we have to keep patients healthy. And so in our courses, the main step was the second part of the course was actually building how do we do the workup so that we can really determine where the patient is at any stage in their life.
Very good. Thank you, Jack, for your time. I really appreciate it. And thank you. This is Daily Coverage from I2OD at Vision Expo West.